Welcome to our comprehensive guide on understanding shock in nursing. Today, we'll explore this critical topic that every nursing student needs to master. Shock is a life-threatening condition that requires quick recognition and intervention, and throughout this video, we'll break down everything you need to know to provide excellent patient care. Let's start with the fundamental concept of shock. At its core, shock is a life-threatening condition where the body's cells fail to receive adequate oxygen and nutrients. This occurs when there's a disruption in tissue perfusion, leading to cellular dysfunction. Think of it as a system-wide emergency, where your body's cells are literally starving for oxygen, which can quickly lead to multiple organ dysfunction if not addressed promptly. Here's a crucial NCLEX concept you need to remember. Shock fundamentally affects tissue perfusion, leading to cellular hypoxia and organ dysfunction. This cellular oxygen deprivation is the common pathway that makes shock so dangerous, regardless of its specific type. Understanding this core concept is essential for both your exams and clinical practice. Shock can be categorized into four main types, each with its distinct characteristics and causes. These are hypovolemic shock, cardiogenic shock, obstructive shock, and distributive shock. Each type has unique pathophysiology, but all lead to the same dangerous endpoint: inadequate tissue perfusion. Let's dive deeper into hypovolemic shock, which occurs when there's a significant loss of blood or fluid volume. This can result from severe hemorrhage, extensive burns, or profound dehydration. When the body loses these vital fluids, blood volume decreases dramatically, leading to reduced cardiac output and tissue perfusion. Think of it like a pump trying to work with not enough fluid in the system. Cardiogenic shock occurs when the heart fails as a pump, unable to provide adequate blood flow to body tissues. This commonly results from severe myocardial infarction, advanced heart failure, or serious valvular disorders. The key issue here is that even with adequate blood volume, the heart can't effectively pump it to where it needs to go. In obstructive shock, there's a mechanical obstacle preventing proper blood flow. Common causes include pulmonary embolism, which blocks blood flow in the lungs, cardiac tamponade, where fluid around the heart prevents proper filling, and tension pneumothorax, which compresses blood vessels in the chest. These conditions create a physical barrier to normal circulation. Distributive shock presents differently from other types. In this case, the primary problem is inappropriate vasodilation, leading to blood pooling and inadequate tissue perfusion. This includes septic shock from severe infection, neurogenic shock from spinal cord injuries, and anaphylactic shock from severe allergic reactions. The common thread is the body's vessels becoming too dilated to maintain adequate blood pressure. When assessing for shock, look for these common signs and symptoms: hypotension, tachycardia, altered mental status, cool and clammy skin, decreased urine output, and rapid, shallow breathing. These signs indicate that the body's compensatory mechanisms are trying to maintain perfusion to vital organs. Let's focus on specific vital signs you'll see in shock. Typically, blood pressure drops below 90-60 mmHg, heart rate increases above 100 beats per minute, respiratory rate exceeds 20 breaths per minute, and oxygen saturation may fall below 94%. Temperature changes can vary depending on the shock type and stage. These numbers are crucial indicators that help us identify shock early. Laboratory values play a crucial role in diagnosing and monitoring shock. Key tests include complete blood count to assess hemoglobin and hematocrit, basic metabolic panel for electrolyte imbalances, lactate levels to measure tissue perfusion, blood gases for oxygenation status, cardiac enzymes for heart damage, and coagulation studies to evaluate blood clotting. For your NCLEX preparation, remember this critical lab value. A lactate level greater than 4 millimoles per liter strongly indicates tissue hypoxia and is a red flag for shock. This is a key diagnostic indicator that often appears in exam questions and guides clinical decision-making. Let's discuss general nursing interventions that apply to all shock types. Your priorities include establishing reliable IV access for fluid and medication administration, providing oxygen therapy to improve tissue oxygenation, maintaining continuous monitoring of vital signs and patient status, positioning the patient appropriately, and being prepared for rapid intervention if the patient's condition deteriorates. Different types of shock require specific interventions. For hypovolemic shock, aggressive fluid resuscitation is key. Cardiogenic shock often requires inotropic medications to improve heart function. Obstructive shock needs immediate removal of the obstruction, while distributive shock typically requires vasopressors to improve vessel tone and blood pressure. To help remember these concepts, use these helpful mnemonics. Remember shock, signs, history, oxygen, circulation, keep monitoring. For shock types, use HGOD, hypovolemic, cardiogenic, obstructive, distributive. These memory aids will help you quickly recall important information during exams and clinical practice. Let's practice with an NCLEX style question. A patient presents with hypotension, tachycardia, and jugular vein distension. Which type of shock is most likely? Options: A, hypovolemic, B, cardiogenic, C, obstructive, D, distributive. The correct answer is C, obstructive shock. The presence of JVD with hypotension and tachycardia suggests an obstruction to blood flow, typically seen in conditions like pulmonary embolism or cardiac tamponade. Here's another practice question. Which finding indicates successful shock treatment? A, increased heart rate, hypertension, C, decreased urine output, D, all of the above. The correct answer is D, all of the above. Improved blood pressure, decreased heart rate, and better urine output all indicate improving tissue perfusion and successful shock treatment. For our final practice question, what's the priority nursing intervention for septic shock? A, administer antibiotics, fluid resuscitation, monitor vital signs, D, provide vasopressors. The correct answer is B, fluid resuscitation. While all options are important, initial fluid resuscitation is crucial in septic shock to improve tissue perfusion and support organ function. Let's recap our key points about shock. Remember the 4 types of shock and their distinct characteristics. Early recognition through careful assessment of vital signs and symptoms is crucial for positive outcomes. Quick intervention with appropriate treatments can literally save lives. Always monitor your patient closely and be prepared to escalate care if needed. Thank you for joining us for this comprehensive review of shock in nursing. Keep studying and practicing these concepts, as they're crucial for both your exams and your future nursing practice. Stay tuned for more nursing education videos to help you succeed in your journey.